tuitoe kwa nguvu nchi yetu ya Kenya tunayoipenda, tuwe tayari kuilinda, tuwe tayari kuilinda.
Career Mothers for Exclusive Breastfeeding, CAMFEB Association 2020, WABA, World Breastfeeding Week, 1st to the 7th August 2020 statement. The 2020 World Alliance for Breastfeeding Action, World Breastfeeding Week highlights the links between breastfeeding and planetary health under the theme, Support Breastfeeding for a Healthier Planet. Breastfeeding is one of the best investments that saves infant lives and improves the health, social, and economic development of individuals and nations. Creating an enabling, sustainable, and friendly environment for optimal infant and young child feeding is a societal imperative that should be a priority in the maternal health care. At CAMFEB, and together with our partners, we inform people about the links between breastfeeding and the environment climate change. Seek to engage with individuals and organizations for greater impact by anchoring breastfeeding as a climate-smart decision and galvanizing action on improving the health of the planet and people through sustainable breastfeeding and infant feeding practices. The interconnected nature of people and the planet requires that we find a sustainable solution that benefits both. Sustainable development should meet the needs of both the current generation without compromising future generations. A sustainable production and consumption patterns should safeguard our natural resources, our environment, and help mitigate climate change. Over time, the scale of human impact on the planet and especially climate is now evident. Depletion and destruction of natural resources and an increase in the emission of major greenhouse gases are at their highest levels. To redress this and to protect our planet, our own health, the society should start using resources such as land, water, and energy sources responsibly, conserve biodiversity, and consume resources with care. Climate change and environmental degradation are some of the most urgent challenges facing our world today. Our current food production and consumption practices are degrading land and water ecosystems and driving climate change. Feeding infants and young children with breast milk substitutes contributes to unsustainable food systems and environmental degradation. Their production, packaging, distribution, and preparation methods affect the environment and climate. On the other hand, breast milk only requires the additional food that a mother needs to consume. Therefore, using fewer natural resources and resulting in almost no waste. In addition, breastfeeding contributes positively towards planetary health in that it is sustainable, ecological, and good for human health. Furthermore, breastfeeding is linked to all the United Nations Sustainable Development Goals and is key to achieving sustainable development for all and preserve planetary health. The ongoing COVID-19 pandemic poses a challenge to food security and nutrition, directly affecting breastfeeding and infant feeding. The pandemic has also strained the already inadequate health systems. Due to this, optimal breastfeeding practices may be compromised, and for infants needing alternative donated human milk through human milk banks may not be readily available, and the supply chain for breast milk substitutes may often be broken. As urgent as the COVID-19 crisis and responses are, there is need to advocate for breastfeeding as a public health intervention that saves lives and prevents infections and illnesses in the population at large. Supporting breastfeeding has both short-term and long-term impacts on planetary health. Therefore, we call all stakeholders and policymakers to support and incorporate maternal health and breastfeeding supporting policies so that breastfeeding can play a pivotal role towards a healthier planet. Thank you. We declare the Kenya Big Latch On celebrating World Breastfeeding Week 2020 officially flagged off.
All right. Thank you very much for that introduction, Martha. And I just want to welcome you all to the Kenya Big Latch On. And I'm glad that we can openly talk about breastfeeding without feeling uncomfortable, whereas tens of years ago, this would be considered taboo. Now, just to put it into perspective, breastfeeding is a prime example of the deep connection between human beings, their health, and nature. Breast milk is produced in the safest means possible and delivered without pollution, packaging, or waste. And in celebrating the start of the World Breastfeeding Week, themed Support Breastfeeding for a Healthier Planet, this virtual gathering seeks to share information on breastfeeding and its environmental impact, focusing primarily on the benefit of breastfeeding as a climate smart decision. Now, this forum brings together like-minded persons made up of, among other things, medical experts, nutritionists, as well as breastfeeding moms, which gives me the honor of introducing my panel. Now, to start us off, we will begin with Martha Kim Kung, who is the host of this particular event. And I just want to welcome you, Martha. That's Martha Mugi Kim Kung, who is the CAMFEB Executive Director and Founder. And then we also have Dr. Rashnik Gali, a consultant pediatrician. Welcome, Rashnik. And Josephine Karoki, a maternal infant and child health specialist. And as well, Duncan Angila, a clinical nutritionist. And let me also not forget Honorable Isaac Mora, nominated MP and National Coordinator for the Albinism Society of Kenya. Welcome, guests, ladies and gentlemen. Now, to start us off, I'd like Martha to just briefly share with us your experience on what led you to start CAMFEB.
Thank you very much, Joy. Happy to be here and to discuss about my challenge, why I started CAMFEB. It was due to personal experience because when I first had my child firstborn, I wasn't able to do exclusive breastfeeding because of various challenges, especially going back to work. I didn't have enough information about breastfeeding and how important it is for us to breastfeed our children. So when I got my second child, I really wanted to do exclusive breastfeeding. Then again, I faced numerous challenges because due to long working hours, the traffic between home and the workplace was a challenge. So you have to like wake up very early in the morning, almost not sleep at night because you have to breastfeed in between the night. So that was such a big challenge. And also the lack of support at the workplace where you were able to comfortably go and express your milk for maybe tomorrow or the day after. So those are some of the challenges that I faced while wanting to do exclusive breastfeeding. And so I thought this is something that so many mothers are going through, and they are experiencing the same problem. And so I thought it would be a good thing to start an organization that would sensitize the society on how important it is for us to start supporting breastfeeding, both the formal, informal workplaces. So that is how I came about to start CAMFEB.
All right, thank you very much, Martha. I mean, your experience cuts across. I mean, it's a experience that many women can also talk about and share. And the fact that you took a step forward to do a proactive thing, like bring, you know, develop CAMFEB and bring women together just to bring support or in various forms. Congratulations, and keep up with a good job. And now, just moving on with the discussion, I'd like to bring in Angela, being a clinical nutritionist who understands the benefits of breastfeeding. How can it be compared to complementary feeding?
Again, thank you so much. I'm glad to join everyone to celebrate this year's World Breastfeeding Week. And just to begin, that breastfeeding is one of the interventions that have been acknowledged by World Health Organization to be able to reduce consequently mortality and morbidity in children. And during the first 1,000 days of life, which begins from the time when the mother is pregnant to the time when the baby is 2 years old, we call that a critical window of opportunity. And nutrition is so important that will be able to help to fix a lot during the last 1,000 days. Benefits of breastfeeding cuts across to the baby, to the mother, to the family, and to the society that we are currently focusing on as breastfeeding for a healthier planet. But just to mention a few, that breastfeeding is important to the baby because it reduces the chances of mortality, morbidity, and even hospitalization. Children who are exclusively breastfed for the first 6 months and continue to be breastfed until 2 years and above have little cases of illnesses and even death cases. It's also important for the cognitive, the brain development. It said that those who breastfeed their children properly well, their children perform well in school. So this is an opportunity. Instead of investing later when your child is in class 1 or class 2, you can start early by ensuring that you benefit from breastfeeding. Again, immune development, as we're talking about COVID-19, and one of the vulnerable groups are children, breastfeeding will really play a role to boost the immunity of the child when we breastfeed them. We understand that currently there are many non-communicable diseases currently, like hypertension, diabetes, and cancers. It is said that breastfeeding reduces the risk of obesity and non-communicable diseases for infant, comparing to, just as you mentioned, children who are breastfed, who are fed on like infant formula. They are likely to develop these diseases in life. Remember, infant formula are just modified cow's milk. They are not the same. Cow's milk is not the same as the human milk, and therefore it means that it overburdens the kidney and it puts them at a risk of developing these diseases in the future. Yes.
All right, thank you very much, Angela, for that. Just trying to bring out the importance or the benefits of breastfeeding in comparison to supplementary feeding, and many people we know would rather sometimes take shortcuts, introducing cow milk, and we know human babies are not cows to begin, you know, taking cow milk, but this happens. It is a reality. And for Josephine Karoki, now you being a maternal, infant and child health specialist, what is the role of a lactation specialist?
So the role of a lactation specialist is mostly to support mothers and to support breastfeeding, because the assumption sometimes is that breastfeeding is going to be very easy and come naturally. But actually, most of the time, especially first-time moms and even follow-on moms, they do need support in terms of usually the techniques, but also just in confidence building. And that's where we come in, and then we work. It's a multidisciplinary team Hopefully, ideally, it's supposed to be a multidisciplinary team where you're working, if it's antenatally, you work from the pregnancy with a pregnant woman, and then you start telling her about breastfeeding, and then you work with a pediatrician after that. So it's basically just being able to specifically support a mother with the breastfeeding and also complementary feeding. Yeah.
All right, you do encourage them to take up complementary feeding. In what stages do you recommend that?
From 6 months. Yeah.
Right.
So basically, the whole idea of complementary feeding is that within the first year, breast milk is still the predominant source of nutrition. So then you're just starting to introduce other foods so that you start closing the different gaps. But solids, when you introduce solids, they're not supposed to take the place of breast milk. So that is also something that mothers need guidance on, so that it's a gradual process.
Right. And of course, we do understand that there are times when supplementary feeding is introduced even way earlier than 6 months. And how do you go about this?
Well, again, if, for instance, you've been working with this mother from the beginning, you're able to support them, because most of the issues are, I don't think I have enough milk, I don't think my baby is growing well. So again, when it comes to those teams I'm talking about, when the mother goes to the pediatrician, and for instance, if there is like a weight gain issue, then instead of automatically turning to supplements, then you come in as a lactation specialist, and hopefully the pediatrician will refer them to you, and you'll be able now to work with that mother and see, is it a supply issue? Is it, where is that gap coming in? Is it an information issue? Is it a confidence issue? And that way you actually stem supplements and solids from being started early.
All right. Thank you, Josephine, for that. And just being cognizant of the fact that we are living in COVID-19 times, Dr. Rashnik, just bringing you in and being a pediatrician, has there been a change in breastfeeding patterns and child-related complications due to lack of breastfeeding, in your view?
As far as the evidence that we have available, fortunately, COVID-19 is a relatively mild infection in children, and most of the patients that we're seeing are asymptomatic. If they are infected, then their symptoms tend to be mild. There are a very small proportion who have larger complications, but if we apply the basis that we know already, which is that breastfeeding will obviously inherently give the baby antibodies and increase their immunity against any virus, then we can assume that the same thing would happen for COVID-19. So we know that particularly if a mother is infected, then her body will already be producing antibodies, and these will be transferred to the baby through the breast milk. So I haven't seen that breastfeeding practices have changed, certainly within my own sphere. And if anything, I think that people are much more aware of the benefits of breastfeeding in infection prevention. So I'd hope that they would continue to breastfeed as much as possible.
All right, thank you, Dr. Rashnik. And Josephine, just bringing you back in, for a lactating mother who has contracted COVID-19, what do you normally tell them? Have you had any interaction with any who has contracted COVID-19 and is breastfeeding?
I personally haven't interacted with any, but so far the studies and whatever the advice that we're getting from most of the major bodies, from WHO, La Leche Liga, Alive and Thrive, and other influential organizations out there, is that to continue breastfeeding. Just to reiterate what Dr. Rashnik has just said, because of the antibodies and generally food safety, so to continue breastfeeding, but to also be very careful in terms of sanitization. So if a mother is COVID positive, is just to wear a mask, to wash her hands often. And there are quite a number of infographics out there. The information is very clear, and it is based on whatever little evidence at the moment, being a novel flu virus. But so far the information is very clear that mothers should please continue to breastfeed and just take the necessary precautions that they would anyway. So just continue washing your hands as often as possible, wear a mask to reduce the chances of transmission, but to continue breastfeeding because the baby does need that nutrition. They do need those antibodies. And especially if you don't have a choice when it comes to supplementation, because the guidelines are that you should only start with any other breast milk substitute if it is accessible, affordable, feasible, safe, and sustainable. So if you're not able to afford formula going forward and you stop breastfeeding, then in the long term, that will become a problem. If you don't have access to clean water all the time, that will be a problem. So this is why breastfeeding is still being advocated for very strongly during this time, because sustainability, accessibility, feasibility is still an issue for very many people, especially here in Kenya.
Right. Yes, we do understand that there is a challenge also to access to clean water, and especially in the built-up areas. How do you go about that? How do you go about encouraging and directing women how to still maintain the hygiene, the high levels of hygiene?
So this is when now, for instance, community health workers come in, and this is why our health workers are so important, and it's so important again to protect them during this time, is because they are the ones who have direct access to these mothers, like you're saying, in the informal settlements, in the low-income areas, where the virus will tend to spread, because again, even for them, social distancing is so difficult. Access to masks, access to water to clean those masks every day. So it's so important for them to be, for awareness to be greater, to access to, on a community level, the different organizations that are working to make sure that sanitizers are available, water is available. But community health workers are incredibly important. And for those community health workers to be equally as informed in order to send the correct message that you need to stay safe, keep your hands clean, wear a mask, but continue breastfeeding, because that is the most feasible and sustainable solution for your baby.
Right, and this question is asked by one of the participants in the group, and Sarah Awar, who is asking, what causes lack of milk to a mother who has just delivered? Can introduction of cow milk to this newborn have negative effects to the growth of the baby? This can be answered either by Josephine or by Angela. Whoever feels more comfortable answering that one.
Okay, I can respond to that. Yeah, sure. So milk letdown is controlled by two hormones. We have got prolactin and oxytocin. Of course, during the first few hours after deliveries, a number of mothers could have problems or challenges with having breast milk. But ideally, every mother is able to produce enough milk. It could be the issues that encourages breast milk. One of the factors that can help the mother to get more milk if they are in relaxed position, and if they are eating, they are drinking, they are hydrated. Again, the opposite is true. If the mother is having stress, they are not eating, they are not drinking, again, that reduces the breast milk. Yeah.
All right, and what the question, further question was that can introduction of cow milk to the newborn have a negative effect to the growth of the baby?
Yes, sure. As you said earlier by one of my colleagues, that cow's milk is different from the human milk. For example, you find that the cow's milk has got a lot of proteins and also have got a lot of salt, which again is not as similar to the mother's milk. That means that if the baby is given this milk, that means it is a burden to the kidney. And later in life, we find that children or even adults, they develop non-communicable diseases, including kidney diseases. So it is not good to give a baby a cow's milk because they are not this. It is not the same as the human milk.
All right, thank you very much, Angela. Now, before we go on, there are many questions coming in from the participants, but I just want to also bring in Honorable Isaac Maura. He's a nominated member of parliament, a father and a husband. What is your view on fathers and breastfeeding attitude, their involvement and support? Maybe you could kindly just come in and give us your view on that.
Thank you.
Right.
Yeah, thank you, moderator. I think the issue for men is that, you know, breastfeeding is a woman's issue, is a mother's issue, and they don't quite get involved. And sometimes I think it's more about provision. So if there is no milk, then ask me for the milk money, I'll give it, and the child will be fine. But there are very few people who actually are conscientious about the power of breastfeeding. And I think for me also, I could have been like that until my wife, got triplets, and they came prematurely when we were in a neonatal unit at Nairobi Hospital. And I could see how breast milk was critical, very critical to those little babies, as they try to survive. And, about, even making sure that you have them ready, even when at night when the mother maybe would not be around. And, how critical they were, seeing them being fed using syringes, and the power of that breast milk with regards to their fastidious recovery and growth. I mean, really, pure breast milk made the whole difference for my son, who is the only one who survived. And that is why I have actually joined women, particularly, in this campaign when there was, a march to Parliament and a petition that we did both in the National Assembly and Senate. And it's good I clarify, because I think it's not coming out well. I'm in the Senate. I've been in the National Assembly, now I'm in the Senate. And I'm a member of the Speaker's panel. That is, I have been presiding over the Senate together with the Speaker. Yeah, so basically, this is an issue that even amongst my fellow parliamentarians, male parliamentarians, they tend to think it's not a very serious issue because it looks almost easy to do it. I mean, you're pregnant, you got a baby, you've been blessed with a bouncy baby boy or girl, and therefore then you breastfeed. But then, just to pass the point home, one of my colleagues, Zuleka Hassan Juma, walked into Parliament with a baby just to demonstrate why we don't have creches in Parliament. And there's a lady that I work with closely. She's actually developing them, and she's helping in selling them to various institutions and companies. And that's what we need to do. And it doesn't require much, to have a breastfeeding booth. But also, it speaks more to policy with regards to reducing the morbidity rate, mortality rate, and also having a healthy population. And I think someone also said here very clearly that it helps in terms of even the intelligence of children. I don't know whether this is purely a coalition for women, but I think men would play a critical role in also encouraging their wives, the mothers of their children, that they also participate in ensuring that the 24 months are attained. Because at some point people give up. You have to return to work. And I really must thank Mother Kim Kung for this, because then it becomes uncomfortable. When a woman is breastfeeding publicly, it's frowned upon. It's looked like it is not supposed to happen. So we have a long way to go, in terms of policy, so that becomes part and parcel of society, and people do not think it's just one of those things, as by the way, but also in terms of changing perceptions around people, so that people are more confident about, bringing the next generation that is healthier, that is smarter, without feeling embarrassed about it.
Right. Thank you. Thank you very much for that input. And just on the same aspect, Josephine, bringing you in, how do you encourage a mother who is concerned about her physical outlook and believes breastfeeding is not cool to actually view it as an essential activity or essential thing to do?
I think sometimes that also comes down to modeling, like who are the people around you? Who are you surrounding yourself with? Have we normalized breastfeeding in public? Do we talk about breastfeeding often as the first, the go-to for infant nutrition? So a lot of it is almost like maybe cognitive behavior change. So just to let people know that this is normal, this is something we have always done. You do tend to find that, for instance, when it comes to marketing of breast milk substitutes, that is something that they play on. And this is why there was that the code by WHO on advertising, because they do play on the stereotypes. Of course, when you go out there and you hold a bottle, you look more like the modern woman, you can go to work and things like those. So it just comes down to perception. And how, in that case, what I would say, how do we market breastfeeding? Because if that's how the formula milk companies, infant milk companies are marketing it, so we can also do the same with breastfeeding when we are advocating and creating awareness and saying that this is the best way to nourish your child. And so that makes it really cool. It makes you a cool mom. It means you're not carrying 10,000 bags and a flask and a bottle, and then you have to sterilize, you know. And these days they are actually very beautifully made dresses and tops that make breastfeeding easier, because the breast becomes more accessible. There are bras that are there, you know. So a lot of it is just modeling. If your friends around you who also have babies and they're breastfeeding comfortably out there, then you will tend to do that as well. So it's just to encourage mothers to go out there, be confident. You're doing what you're supposed to do as a mother, which is feed your baby. So yeah, it's just to encourage mothers to do it more often and to market breastfeeding, not just as a nutrition must have, but also it's cool. Yeah.
Right, right. I think that's a challenge, Martha, there, and anyone else who would be campaigning for this, to market. I mean, we have a challenge right there to market breastfeeding as cool and, you know, it's something important, something healthy and environmentally friendly. And going just back to the comments from the participants, Maureen Sungu is asking, what happens when a baby rejects the mom's nipples? 3 weeks now and opted to express and bottle feed. That's a mother who has gone into bottle feeding at 3 weeks. Josephine, I don't know, Angela, who among you would feel more comfortable with that question?
Can I throw it to Esther, who's been quite quiet?
Hello.
Hi.
Hi. So basically what happens is that we encourage babies to be put on the breast immediately after delivery. If there's a delay, sometimes what happens is that this baby is not given that opportunity and the suckling reflex can become a bit weak. There's also introduction of nipples and bottles, especially the artificial teats to the baby, and it causes what we call nipple confusion. So when you give a bottle before the baby is confident with breastfeeding, then this baby gets used to the easy bottle, because with a bottle, it's quick, it's given quickly, it uses less muscles in the face, and this baby gets confused, and then they prefer that to breastfeeding. So we encourage moms, put the baby on the breast immediately after delivery so that the baby can stimulate milk. And if you are in trouble, 3 weeks is pretty early. So I encourage that mom to reach out to some of us. We will be able to help, because 3 weeks is pretty early. The baby can still learn, and then come and assess what's going on, what's causing that. And then we can be able to help. Yes.
All right. And Caroline Kimondo is also asking, can I wean my 4-month-old baby? I cannot pump since I don't have a fridge and formula is too expensive for me. I think, Josephine, you can answer that.
Okay, normally they say between 4 and 6 months is okay to wean, but also there's a way that I'm not sure what she means by not being able to pump. And again, this is why we have a number of us, like for instance, you can see I'm from the Kenya Association for Breastfeeding, and that's why we have specialists, because we'd be able to now sit down with her and see, when you say you can't pump, what is the issue there? And then also come up with a program where even if you don't have a fridge, there are other measures that you can take. For instance, from the supermarket, you can buy one of these insulated lunch boxes, yeah, and then you can still keep your milk cool within a certain number of hours if you've pumped, for instance, in the morning, and you give that to the baby. How far from work do you stay? So there are still certain measures that can be taken before you start formula or solids. So I would say that I would need more information before I can give her like a proper detailed answer, but she can definitely reach out to any of the members of the Kenya Association for Breastfeeding, and we'd be more than happy to support her.
Okay, and Masi Akinyi is asking, in case where, I think we had more or less answered this question, but let me just answer, bring it up. In case where a mother is COVID-19 negative and the child is positive with the virus, what to do? In this case, the mother is negative, but the baby is positive. Does breastfeeding continue?
Yes. Yes, most definitely. And just take the same measures, wear a mask, wash your hands, keep the babies just clean. Also depends, I'm assuming maybe the baby is asymptomatic. So again, just continue just what Dr. Ashnik had mentioned before regarding COVID-19 and how to handle it in babies.
Angela, you wanted to say something?
Yes, I just wanted to add, because of the component of the breast milk, it is able to boost the immunity of the baby. And so I would advocate that the baby to be breastfed, because that is the only way we currently have that the baby is able to boost the immunity to fight the virus.
Okay, and there's Halima Ali, who is asking, would you advise on pumping and storing the milk for long, and what to do with the milk if not bottle feed the baby? I happen to have a lot of milk, so I'm pumping and storing, but not feeding the baby the stored milk. Advice. She's seeking advice there. That's lactation. Josephine, would you be, or Angela, you can answer?
Yes. I think it's advised that after 8 hours, you don't need to give the baby that milk. And if the mother is having enough milk, I think you give the rest, you can discard. Because if you store it for a long time, again, it will go bad and it is not healthy for the baby. At room temperature, the breast milk can be okay for 8 hours. If you put it in the fridge, it can take even longer hours. Yeah.
All right. Just bringing back Honorable Mwaura. There is the aspect of actually, Angela, I want to pose to you the same question that I asked Honorable Mwaura earlier. What your view is on fathers and breastfeeding attitude, the involvement and support. Do you have anything, a different view from his?
Not really different, but I think it's a subject that I'm really interested in. I'm actually doing a study on the involvement of fathers in breastfeeding, and even on issues of ANC. You realize that long time you used to call the family clinic to be mother and child clinic, and it was changed to family clinic. Just it doesn't look, it's for the mother and the child. If the mother is not able to attend, the father can go or even they accompany them. And so there are various measures that are being put in place to ensure that fathers are involved. A father who is more knowledgeable about breastfeeding will definitely support it. If the father does not understand it, probably they are not able to support it well. And so I believe that it is important that fathers are engaged, involved in breastfeeding. And I just love last year's theme was talking about empower parents to enable breastfeeding. And meaning that if a father and the mother come together, they're able to really help. And an example I will give, for example, if the mother is not able to breastfeed because of a frustration, a father who is not knowledgeable enough will really give money to buy the infant formula. But he who is knowledgeable, have good attitude about breastfeeding, would really try to encourage the mother to breastfeed and probably help in home course and do a few things. Yes, I think fathers have a place to play in breastfeeding. It is not just the mother's issue, it is the father's issue as well. It is a family issue, and it is all of us to help and support breastfeeding.
All right, so this is a community, societal, and family responsibility. We all get involved. Now, just to break a bit there, we had a breastfeeding photo contest in the course of the week, and would like to announce to you there were 6 winners, and we'll announce them in the course of the session, but maybe I'll just start with 2. The Carol Kimondo was one of the winners. Philomena Cheporion is also another winner. We'll continue announcing the other 4 in the course of this panel discussion. And now, Martha, what for you do you feel was the biggest do you think is the biggest impediment to achieving express breastfeeding, especially at the workplace? I know you had mentioned some, but maybe to just put it as a in perspective, not just for yourself, but in generally, what your experience has been in terms of the biggest challenge for breastfeeding in the workplace. Martha, is Martha in?
Sorry about that. So I think the biggest challenge here is just lack of support at the workplace for women to achieve breastfeeding. The only thing we need is that we have a law that says, we have an act that says that all employers should set up lactation rooms at the workplaces. So it is a good thing that we have that law, but then again, we need it implemented, because if we don't have that, then at the end of the day, the women will not be able to do exclusive breastfeeding. Once the mother gets back to work after 3 months, we'll go to the office. They have no space to go to express the milk, and therefore most of them will not find it appropriate maybe to go in a toilet and express milk there. It's just like it's just like saying that we need to go and have our lunch in the toilet, which we can't do that. So at the end of the day, you will find so many moms opting to just give up on breastfeeding because of lack of support system at the workplace. What I would encourage and put it out there to all employers is just set up even a small room for mothers, even if it's one mom who is breastfeeding in your company, then it means there are more mothers who are breastfeeding in other companies. At the end of the day, it is a whole generation that needs to be breastfed. And therefore, we need to put up lactation rooms so that we are able to achieve exclusive breastfeeding. Then again, we are taking, it's about taking care of our future generation.
Okay. Honorable Maura, let me bring you in because you're a member of Parliament, and Martha has just mentioned about the Health Act 2017, which requires that medium to large employers, 50 employees and above, create safe spaces for lactating employees and a creche in order to sustain express breastfeeding. I know you partly mentioned it earlier, but so far, not many employers seem to have complied. What do you think is a challenge, Honorable Maura? We still have Honorable Maura online. All right, no, it seems to. Okay. I don't know, Martha. Then maybe you can take that up. What do you think is a challenge in achieving lactating or in the implementation of the Health Act 2017?
That's for me, Joe?
Yes, Martha, yes, please.
Okay, I think the challenge here is that we're not seeing it as a priority because we think that it's just a few months and the baby is 6 months old. And so we are not putting the effort or the emphasis of setting up the lactation rooms. So again, I'll also take it back to our government, Ministry of Health, because we have the Health Act that employers need to set up the lactation rooms. Then we need policies or a procedure for the implementation, because the law is there, it's good. Then again, the implementation process is what is lacking, and therefore there's that lacks that the employers are not taking it up and maybe seeing this as an urgent issue to address for setting up the lactation rooms.
Okay, and Dr. Rashnik, how can we ensure that mothers are being supported to start breastfeeding within an hour after delivery, and especially after a cesarean section?
I think that, as I think Josie touched on, we actually need to start empowering women and teaching them antenatally. So I've worked quite a bit with Josie and Esther, and sometimes I have sent my pregnant patients to them to start having some education prior to actually having the baby, because that's when they tend to have a bit more time and they're not so tired and they're able to actually take in the information that they're being given. By educating them early, by the time the baby's born, they already have some idea about what to expect. And they also tend to have a bit more confidence about, you know, the practicalities of breastfeeding, like latching the baby on and what's expected of them. Within the hospital setting, it's important that the nurses and the doctors who are looking after the mum and the baby are there to remind and support them. It's important that you bring up cesarean sections, because particularly if it's been an emergency, it can be quite a shock for the mother. And from a practical point of view, just moving around can be difficult. So it's difficult to get into the correct position in order to breastfeed the baby. They're often in a lot of pain, and they may have been anaesthetized. So it's important that, you know, all of us as health professionals work together to support the mum in that critical first hour, and then for the days and weeks and months beyond that.
Okay, and just a look at the participants. Charity Patrobas is asking, hi, I'm a 3 weeks mom. Not sure if baby's getting enough. I've used lactation tea and cookies. How do I produce more milk? Our issue here is about producing more milk. Josephine, I think that's an area you would answer.
So this is especially at the first 6 weeks are very, very difficult for any mom, and I think that is the most important question to them. I don't think my baby is getting enough. I don't have enough milk, because maybe the first week it's taken a while for the milk to come in. And this is again where education comes in, and prenatal education is, because then a mother would know, actually, in the first 10 days, your milk is coming in different stages, in different textures, in different amounts. So by about 3 weeks, because that is probably when the milk is starting to calibrate. So it's looking at the number of diapers the baby is producing, urine, stool. Is the baby contented? Is the baby... Okay, of course, growing in terms of growing into their clothes as well. But for the first 6 weeks, it is very difficult to be able to tell you, expect to pump X amount, for instance, 100 ml, then you know for sure your baby is getting enough. Because literally your body is still trying to understand what your baby needs, what it needs to produce. So it's a lot of that demand and supply that we hear about out there. Breastfeeding is demand and supply. So the more you put the baby to the breast, the more your body produces. It is a very, very basic system. So the more you put your baby to the breast, the more your baby produces. So if you're skipping feeds because maybe you're supplementing with formula, that is a feed that your body has not had a chance to produce for itself. So it is likely that production is then going to go down. So it is a very simple system.
Okay, and another question here by Faith Gashero. She's asking, is breast milk affected by the foods the mother takes? To an extent, a baby gets allergy after breastfeeding?
I can answer that one.
Okay, all right.
Certainly in young babies, allergies can manifest in a number of different ways. So for some, it's relatively mild and it might just be some dry skin or eczema. For others, they may have reflux or regurgitation of milk. Often that's painful. They can also have loose stools. Sometimes the stools are mucousy or even have blood in them. And all of those are some of the signs that we may see in babies who are allergic. In very young babies, the most common allergen is cow's milk protein. And a lot of the symptoms will resolve once the mother who's breastfeeding stops having cow's milk products in her diet. Other common allergens are soya, sometimes egg. I'm seeing a lot more allergies to corn, but you need to, see your doctor and be advised accordingly.
All right, and she did ask on the same question, Dr. Rashnik, if the food the mother eats has
yes, absolutely. So yeah, so that's what I mean. All of these allergens ingested by the mother the proteins will be in breast milk and therefore cause an allergy in the baby. So yeah.
Right, and how can a mother be able to tell what exactly she's eating that may be affecting the baby so as to hold back on?
I think, unfortunately, for a lot of these allergies at this age, testing is not accurate, and it doesn't test for the actual allergy mechanism that causes these symptoms. So a lot of the time it's about eliminating the possible foods under the guidance of your doctor, and doing that for a period of a few weeks, and then restarting that food and monitoring for change. So it's what we call an elimination and then reintroduction, and it would just be monitoring. There's no real testing that we can do in most cases.
Okay, and then Eunice Mumbua Odwar asks, how do you go about inverted nipple? I'm 2 months to delivery and one of my nipples is inverted. Would that be you, Dr. Rashnik, to answer that?
Maybe Esther or Josie would be best placed to answer that.
All right.
I'm happy with Esther to take that one.
So for inverted nipples, that mom who has inverted nipples, there's really nothing much you can do whilst you're pregnant. But after delivery, it is possible to be able to get the baby to latch onto that breast. Usually you might need some help from somebody who is specialized to show you. But basically, the thought is, I even have a bulb here. I don't know if you can see. So most of us usually think about the baby just getting the nipple in terms of latching. But what the baby actually needs to hold on to is the dark area, which is the areola. So our main aim is for you to achieve a very deep latch so that the baby is able to get much more of the areola and you'll still be able to achieve breastfeeding. Sometimes putting something cold on the nipple can help it just protrude a bit for the baby to be able to latch. There are some tools that you can use, but mostly you don't even need all that. You can get a deep latch, and once that is achieved, you'll be able to get the baby to achieve breastfeeding. A lot of times, this is something that is internal, and there are some fibers that are holding the nipple in, and it does take a while for the nipple to completely protrude. And it's the baby, as they suckle and get the suckling going, it's the baby that will allow that nipple to completely protrude. So please seek help. If you're not able to achieve breastfeeding, seek help early, and at least you're doing it before you're pregnant. Reach out. Thank you.
Okay. All right. And Doreen Wanjiku is asking, what do you advise a mother who has twins and doesn't have enough breast milk and can't afford infant formula? The baby is of 4 months. Jocelyn, would that be your area?
Again, it comes to the idea of what is enough milk, and how is the mother measuring that not enough milk? So is it because that the babies have gone in for their weigh-in and the doctor has told them weight gain is being compromised? Is it because of the way she feels her breasts are? Again, more information is required. Did she give the age of the twins? Did she say how old they are?
She said they're 4 months.
They're 4 months. Okay. Also at 4 months, there's what we call a growth spurt. So it could be that maybe they seem to be hungry after each feed, but actually that is normal because they're growing at an accelerated rate at that time. So the body's production needs to catch up. So there are also more questions required, but usually by the time my mom is saying, I don't feel I have enough milk, it's usually a perception. So again, it's just giving her the information that she requires in order to understand, is it truly a supply issue, or are there just a few more things that can be done, and to give her the confidence to know that actually, no, this is a normal stage in breastfeeding. But if it's 4 months, it might be a growth spurt where the babies are growing a bit faster, their energy needs are higher. So she just needs to keep breastfeeding them on demand so that the body produces enough milk to meet their calorific needs.
All right. And Grace Njogona is asking, hello, in a case where a mom passes on after delivery of the baby, is it possible for a lady who might be the aunt to the baby, who has never breastfed a baby, maybe because she has never had her own, be able to breastfeed the child, and is it advisable?
So two things there, and it's actually quite interesting because recently in COVID times, one of the things that WHO has talked about is wet nursing in different communities, and so they've come back and touched on it. For us, it was a bit difficult, especially with the huge HIV, the prevalence of HIV before. But wet nursing is something that it is spoken about and it is out there. And unfortunately in Kenya, we don't yet have a milk bank, a human milk bank that's open to the public, but that would be the other solution. But what she is saying is that if that person, that family member is trusted, and they know there are no communicable diseases, it is possible. And then the other thing there is about lactation for a woman who hasn't had a baby yet. It is possible. Again, as Duncan had said before, because it's just all about hormones and putting and stimulating the breast and stimulating the brain. It is possible for even a person who breastfed 10 years ago to relactate. It takes a very long time, but it's very, very possible. It's just about stimulation, release of hormones, and milk production happens.
All right. There's some questions that are being asked and they seem to be repeated and they've been basically answered by the panelists. I think I will skip some. And but Mary Getonga is asking, what is the right time to start expressing?
Maybe Esther?
Yeah, I think
Angela.
I think expressing, you can do it at any time. Yes, there's no exact time to start expressing because it's either you breastfeeding your baby directly on the breast or you are actually expressing, or you can do both. For example, you can express when maybe you're relaxing and you want to maybe top up. So there is no exact time. Expressing is good. You can do expressing at any time.
Right. And Mary Getonga is also asking, is it advisable to hold the breast for the baby as he sucks? Lactation specialist, I think Josephine or Esther, you can answer that.
Esther,
is it advisable to hold the breast when the baby sucks?
So we do talk about supporting the breast when the baby is feeding, but you should support it. We tend to, sometimes the tools help. We tend to hold it like this, but we call this scissoring. It's like you're putting a scissor across the breast. So when you scissor the breast, that will make milk not to flow. You'll be blocking your ducts. So we do say you support with 2 fingers down and the thumb on top, so like a C, like that. So when you support the breast, just to help the weight of the breast to be comfortable for you and for the baby, so that the baby, especially for very small babies, the preemies, it might be good to support. But as the baby grows bigger and they're able to figure it out, you find that they're able to breastfeed comfortably. Make sure that when you support the breast, you're not so close to the nip, to the areola, because then you'll be blocking the baby from getting a deep latch. So basically, it's just a support for the breast. For moms who have very heavy breast, another trick is to fold a little towel and put it on the breast, and that can offer you support as well, so that you're not also feeling the weight of the breast, because sometimes, especially for us Africans, when we give birth, our bust, we are blessed, so our bust can be quite heavy. Yes.
I think, Esther, there's so many questions for you, and I think I will leave some of them so that I understand Honorable Maura is back. And maybe we can just go back and engage him. And Honorable Maura, I was asking a little earlier that the Health Act of 2017, you had partly mentioned it a little earlier. Martha also did mention about it. It requires that medium to large employers, 50 staff and above create safe spaces for lactating employees and the creche in order to sustain express breastfeeding. But so far, not many employers seem to have complied. What is your view? What is the challenge?
Yeah, thank you very much. I think the challenge is priority of issues, and that's why we need to have more men joining this conversation. Even here, if you look at the audience, majority of the people are actually women. And it would help so that then people can understand the role that they have to play with regards to implementing these policies. Why? Because majority of these companies are led by men. And so this then becomes a woman's issue. And we were having a conversation yesterday somewhere about the changing gender roles and also perceptions around it. And allow me to give two examples. Now, breastfeeding for women, men look at it as exposing your private parts in public, because then it is sexualized, and rightfully so, you can say so, but then it's not seen as a multi-purpose. That's number one. Number two, the cultural aspect. If you walked into a home and you found a man feeding a child, maybe using a bottle, you will say, in the way we put it, I'm a Kaliwa, you see. I mean, it's fairly recent, and Daktari has put it actually, that we have now family clinics. So, for example, I take my wife to the clinic many times because of our son, and there you feel comfortable when you're holding your baby. But if you walk around the streets, maybe you're carrying, the baby, or you're in a public place doing exactly that, it's becoming more common, but traditionally still it's awkward. So I think it's a question of also changing the gender roles, so that men are more appreciative of their participation in doing not just breastfeeding, but also, for example, changing a baby's diaper. And that way then people can start seeing the need to have such kind of safe spaces, where you can actually breastfeed properly, that then it moves from the home to the workplace. And I think we must also remember that laws by themselves are not an end in themselves. They are an enabler. So it is us to breathe that, life into that legislation, which is positive law. And how do we do it? Is by having this kind of conversation that we're having here today, and amplifying, the International, Breastfeeding Day, and trying to bring more men, into this conversation and seeing the value. And I think such conversation is properly augmented when we also, bank on the positives of breastfeeding, because sometimes, it's seen as if it's just another way of feeding a child. So that we give it preeminence, and therefore it becomes preemptive with regards to how then we look at our national healthcare system, with regards to how we look at our innovation, because of intellectual quotient, but also in terms of, bonding families together, and especially when fathers are wooed into, seeing this, even having it as a conversation in their so-called men's conference, especially because it is increasingly becoming clear that, children tend to be closer to their mothers than their fathers, because they are the ones who are involved in their bringing up more closely. So there's a personal touch, so that then you break down the machismo, the hardcore, hard, emotionless kind of, outlook and paradigm that men are supposedly, supposed to show to their children, in society and within the family. So I think those are some of the things that even we are able to use the law as it is, that would help. But also, we need also to look at it as how do you break these barriers? So it's actually to have champions within institutions, because it starts with one or two individuals and others move forward. So I am encouraging CAMFEB and Kenya Association, of the medics who are here, so that we start then looking at how do we penetrate this and, amplifying amplifying this voice, and also rewarding institutions. I don't know whether it's part of the awards or the recognitions that are being made today, rewarding institutions that have gone ahead to, implement such a policy, so that then it becomes, what the French call bonne politique, good practice. And that way, then many people will be rallying themselves to compete to ensure that actually becomes the case. And also, it will help, of course, if more women are in positions of decision making. Although that in itself, I must confess, is not a guarantee, because I've also seen it in Parliament. It doesn't mean that the nominal increase of women in Parliament necessarily means that they are positive pieces of legislation that support women and motherhood. It actually calls for people who are engendered and who are actually dyed in the wood in terms of seeing this as a key priority. And that can only happen if we encourage more and more people to get into this conversation.
All right, thank you very much, Honorable Maura. That was very detailed. You've mentioned the issue of involving men to have buy-in, even at the policy level, having champions to champion the push for the implementation of this act and a reward system. And Angela wanted to add something. We are constrained for time. We need to come to an end, but maybe briefly, Angela, I'll give you an opportunity, just briefly add a point to what Honorable Maura has said, even as we come to a conclusion of this particular discussion.
Yeah, just wanted to add about, there is a particular nutrition model that is called Baby Friendly Community Initiative. That works in the community, and in the hospital we have got Baby Friendly Hospital Initiative. In the community, we have a way in which we are engaging men by forming men-to-men support groups. These men, for example, if you're working in a place where men, if you want to meet men, you need to meet them in the eating like a goat. So you involve the chiefs, you involve the key men in the area that are known to be examples, and we have such discussions. This helps to improve the social behavior change, even as we have the policy. And so I've seen it work in communities where we involve men to reach out to other men so that they're able to influence maternal and child health as well as nutrition. Yeah.
All right, thank you, Angela, for that. Now, we are coming to the end of this discussion, but we are not done yet because I will leave you in the able hands of Esther Kimani, who is a lactation specialist and who will talk to us more about demonstrate how to do the latch on and the different techniques. That is shortly after this. But before I let you go, let me just announce the winners of the competition, the breastfeeding competition that took place this week and which ended it ended yesterday. And so the winners are the Carol Kimondo, I had mentioned, the 6th Philomena Cheporion, Eddie Akon, Rose Rotich, Lily Mwachofi, and Caroline Njoroge. So those are the 6 winners of the breastfeeding photo contest. They sent in their photos, and we just want to appreciate them. And even as we call this a wrap for the time being, I think I will have, Martha is requesting to have a statement. I think I'll just give each one of you an opportunity to make your concluding remarks and make them brief so that we can also save on time and move on to the next session. Angela, since you're the one on the right there, kindly we can start with you. Give us your final comments as we give another person an opportunity.
Yeah, mine is again to thank all of us for finding it important to celebrate breastfeeding. And I said earlier that it is one of the key interventions that will really help us to reduce the child mortality and even morbidity. And so we join everyone. Breastfeeding is not only a nutrition issue, it is an economical issue. It's everywhere. And so I believe when we embrace breastfeeding, we are able to go far. Thank you.
All right, Dr. Rashnik.
Thank you very much for inviting me to be part of this discussion. I think that we've touched on a lot of really important reasons for promoting breastfeeding, not only individually, but also as part of society. and they can take all of this forward and continue to educate everybody else about the importance of breastfeeding.
All right, Josephine Karoki.
Again, thank you for inviting me to be part of the panel. I think in line with this year's theme of support breastfeeding for a healthier planet, it has to start with all of us. So right up from the government and how the government can strengthen our systems so that breastfeeding becomes a priority for them, educating health workers so that they are also able to support mothers. Making sure that they implement the WHO code of marketing so that we don't have so much promotion of formula, infant formula, because that is actually why breastfeeding is much better for the climate than formula, because of the amount of pollution that happens for formula to be made. So I think we definitely need to continue advocating, asking for the government's help, but all of us playing a part. And just to let mothers know that there is support out there. There is the Kenya Association for Breastfeeding. Esther and I and Martha are also all members, and working together with doctors, like Dr. Rashnik said, I work closely with her to support mothers. So support is out there, the correct information is there, and we're always prepared to work together to make breastfeeding work. Thank you.
Right. Okay, Dr. Isaac, Honorable Maura, your final comments?
Yeah, thank you. And you're not wrong. I'm actually Dr. Maura. So,
okay.
Yeah, yeah. I think COVID-19 has taught us that the pre-existing medical conditions are actually as a result of poor health on the part of any individual, and so therefore breastfeeding then becomes justified even for the current and the future generation, so that then we have a more resilient population. So just basically to say that we need to also in our hashtags, in our information, we need to bring this out, that we breastfeed so that tomorrow, in case there's any pandemic, we not only survive this one but we also survive it then. And further to say that we need men to, be brought on board to breastfeed, even when, for example, they have been left with the children. They can be able to give that, bottle, to that child, so that then it becomes more friendly. It becomes something that they can actually put their hands into, not something that they think it is just out there. Otherwise, thank you very much for such a great and illuminating conversation. I must confess, I've also learned a lot, even if naturally I cannot breastfeed.
Okay, all right, Martha, we can end with you, your final comments.
It is great to have had this session, and from the conversations, we can see that the mothers are already willing to breastfeed children. So what we need, missing gap here is that we need to support mothers to do exclusive breastfeeding and up 2 years with complementary feeding. So these are climate smart decisions. So let's support the mothers to breastfeed. It takes a village to breastfeed. So we invite the society, the community, support mothers, even normalize breastfeeding, like a mom can breastfeed anywhere, anytime. So let's join hands together and help continue making a smart decision for a healthier planet. Thank you.
Thank you very much, Martha. Thank you to all the panelists. And I will leave you now in the able hands of Esther Kimani, as a lactation specialist, who will, demonstrate to us and to mothers out there who the many questions coming through. How do I do a latch on? How do I ensure that my baby is feeding and feeding well? And she's going to demonstrate that. And I would encourage you to stay put so that you can learn and ask all the questions to our able Esther Kimani. Over to you, Esther. Thank you very much.
Thank you so much, Joy. And a lot has been said. And so I just want to do just a few pointers before all mamas that have babies. We're going to be latching on together. We are going to have a countdown after this. And we hope that your babies are awake and we can put our babies on the breast. There are just a few things that make successful breastfeeding. It is a challenge for many mothers and many dads as well. But if if you follow these few pointers, you're going to find that you're going to have a successful experience. And the first one is, number one, have baby on the breast. A lot of us, there's been a lot of influence from the books we read, people that we hang around with, and there's a lot of, you know, routines and all these things, and they are important. But at the end of the day, what helps the body make milk is that baby on the breast. And there's a connection between the baby, your brain, and the breast. And the more that baby is put on the breast on demand, when the baby needs to feed, when the baby is showing signs that they need to feed, and babies will show you that they want to feed by, they'll eat their hands, they'll smack their lips, mwah, 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 they'll look for the breast. And all these things that babies show that they want to feed, please put them on the breast. Try and avoid doing what we call routine feeding. So for newborn babies, especially before 6 weeks, it is important for you to keep a close eye so that they don't oversleep. We say 2 to 3 hours. And so if your baby is oversleeping, you do need to wake them up. But as much as possible, also don't say that you'll have to wait for 3 hours for the baby to feed. Sometimes the baby will want to feed after half an hour. Just like you and I, sometimes you want to feed, you want to take some water, sometimes you want to take some food. After 30 minutes, you're looking for something. So we ask you to follow your baby's cues and let the baby feed as often as they want to feed. That's what sends messages to the brain. I like Josie usually uses a particular, what would I call it? She usually says the brain is a factory and we have a customer placing an order on the breast. And I totally love that analogy. And this customer, the more they come and place an order on the breast, the more milk is made. So keep putting the baby on the breast. There are many questions of how do I make more milk? More milk is having that customer placing an order on the breast. We can also include expressing. A lot of moms asking about expressing, but we do say that the first few weeks, 2-3 weeks, spend it on just perfecting that breastfeeding act. If you also add expressing into it, unless your breasts are very full and you need to have some comfort, I find a lot of moms get stressed because they're trying to express, they're still trying to get the baby to latch. Unless there's a need where the baby needs to be fed or supplemented with your breast milk, if the baby is breastfeeding comfortably, concentrate on just that. Healing, because you've also gone through pregnancy and birth, healing and getting the baby to feed. Once now you are comfortable, then you can now start expressing, either to have the baby supplemented or topped up. Unless there's that need, then take your time. Get comfortable, know your baby. Then now as you start to express, you're more relaxed, and now that can be a process every day. Also avoid expressing too much. There's also a problem of overproduction. Of late, we've started seeing, because people are having, they're competing on how much milk everyone has in their freezer. We're finding some moms now getting overproduction, and a few moms, sadly, we've even had to stop breastfeeding because the overproduction leads to now other health issues like mastitis and abscesses because of now too much production. So they can also be overproduction. So express maybe once or twice a day just for that extra milk that the baby needs, and you're going to find that you're comfortable and you're breastfeeding. At the end of the day, even bottles contribute to climate, the bottles that you're producing. If there are so many, they're also contributing to not having a very sustainable climate. So we want, as much as possible, let the baby get the milk from the breast directly, and only have to supplement when you're not there or for other reasons that Daktari would probably let you know. But a lot of times, especially the first few weeks, let the baby get the milk from the breast. The other thing is that you do need to have your baby positioned properly. So ensure that any position that you take, you are comfortable. The baby is being brought as close to you as possible. We've always had tummy to tummy, but we changed that term because what happens with tall people, when they say tummy to tummy, then they turn their baby towards their tummy, then the baby is too low. So the baby should be at the same level as the breast. So you ensure that your baby is as close as possible. If you need pillows or you need other things that will help the baby get as close as possible. So let the baby be at the same position as the breast. Make sure the baby completely turns and faces you. Because if the baby is not facing the breast, it means that they'll have to turn their head. And I always say, if you turn your head and try to swallow, that's a very difficult thing to do. So the baby needs to face their food. Let the baby's face directly on the breast. Ensure also that you avoid giving, we've talked a lot about formula and artificial feeds, water, all these other supplements that we do, because they fill up the baby. And what happens when they fill up the baby, then the baby will not want to breastfeed. And as I've said, if the baby is not on the breast, the factory is not going to produce the milk. And finally, ensure that we get lots of support. It's a family event. Adding to what Honorable Maura was saying, if the dad's in the family, I remember when I was breastfeeding and my mom would come and say, we need to give the baby food. The baby can't be full on breast milk. And my husband would say, no, we are exclusively breastfeeding. And all our moms would be like, okay. But yet when I said it, we are a patriarchal society. When I said it, I wasn't listened to. So dads, you play a very big role in helping the women in your life to achieve exclusive breastfeeding and to continue breastfeeding. We found that when the dads come in, then their word is listened to. When you come in and support the moms, when you say, when you breastfeed, I can help, birth the baby and you can get some rest. You find that at the end of the day, you are going to achieve breastfeeding. Get some help, mamas. If you're feeling overwhelmed, it is okay to express some milk and have someone else feed the baby and you can take a break. It is hard work, but it is worth it and you can do it. And so at this point, I'd like to ask all the mamas to put their babies on the breast. And I wish I had a baby, but my baby's a bit. But for all the moms who have babies, and we're going to count down to the big latch on. We celebrate CAMFEB, we celebrate breastfeeding. Happy breastfeeding week to everyone. And we're going to start from 10. And the panelists can help me count down. Yes, from panelists, help me. 10.
10,
9.
9.
8, 7,
7,
6, 5, 4, 3, 2, 1. Yay! Oh, you look so good. Amazing. Kenya's big latch one is on. Thank you, Martha.
Thank you.
Thank you.
Oh, you look so amazing, moms. Yay.
fantastic.
Oh, really nice. Oh, that looks really nice. Oh, the babies love it. You look so awesome, mamas. Thank you for doing this great job. Somebody's saying their baby slept. That's okay. So thank you all. As we leave, you can stay on a bed, enjoy the music as your baby breastfeeds, and we celebrate all of you. Thank you.
Bye.
Thank you, Martha, for the great job.
Thank you very much,
Bye.
Esther. Before you go, thank you very much, Esther. Before you go, I'd like to do a vote of thanks for a minute. Before you go, one moment. Thank you so much. I would like to say thank you. I would like to say thank you very much for being available to do this. Number one, I would say thank you very much to our partners, APHRC, Africa Population and Health Research Center. Thank you for supporting us. Also, we would like to mention that we will be having another event to celebrate World Breastfeeding Week with APHRC on the 4th of August from 4 p.m. to 6 p.m. So we hope that you will still join us. We will share the link on our Facebook, and also I'm sure we will be live for that particular event. We'd also like to thank Kenya Association for Breastfeeding for partnering with us. We say thank you for your information and helping the mothers out there. So for all the moms who have breastfeeding issues, please, there is help that you can get here in Kenya so that we can achieve exclusive breastfeeding. And also thank you to Johnson Baby, who enabled us to have a CAMFEB breastfeeding photo contest. And we'll be awarding the winners throughout the week. We will give them their goodies and share with you. Secondly, I would like to say thank you to all the panelists, Honorable Maura Isaac, Dr. Rashnik, Josephine, Duncan, Esther Kimani, moderator Joy Kiruki. Thank you all for creating time to do this. And this was very informative. And I hope we can also even engage more with the public apart from just the World Breastfeeding Week, because we really need to pump the issue about exclusive breastfeeding and up to 2 years with complementary feeding. Thirdly, we would also like to thank all of you who joined us via webinar or followed us live on Facebook. Thank you for joining the discussion. Please be ambassadors out there and continue advocating for breastfeeding. To all the mothers who joined us at the big Latch on, who you were able to see doing the Latch, we thank you so much for being available and doing that. Thank you so much. Lastly, I would say thank you to the mothers who participated on the breastfeeding photo contest. Thank you for the winners. That was amazing. We will continue doing this so that we can continue advocating and sensitizing people about breastfeeding. So all of you who participated, I have a list. There is Shiko, there is Martha, there is Sheila, June, Queen, Juan, Sheila again, Tony, Lydia, Janet, Liz, Pamela, Mercy. Thank you so much for doing this. Lastly, to the team, CAMFEB, thank you for putting up this and for your time and efforts to make sure that we are celebrating and we are making, we advocating and preaching about breastfeeding. So please, let's continue to helping moms to make this smart, climate smart decision for a healthier planet. It is for all of us, for our future generation. So please, thank you so much, and we hope to see you again. See you.
Thank you, Martha.
Bye.
Bye. Take care.
You too.
Papa asante, kweli we ni Mungu. Papa asante, kweli we ni Mungu. Kama una hasule lazima utulie, ujivunie, ubangaize. Bara ya kazi lazima utakite, uburudike, jiachilie. Sunday. He not supposed to lack you. He's supposed to back money. Imana oyena bambo supposed to hammer. He's supposed to hammer. Oh, he's supposed to make a move. Ila usisahau siku nguvu zako sema asante. Weli yeni Mungu tena si hatia spend your money sema asante. Weli yeni Mungu hata ukikosa sema asante. Weli weni Mungu na ukipata sema asante. Weli weni Mungu Papu Rose no more enemy Papu Champagne no more complaining. If you dey live for Kenya anywhere in Africa make you dey pump anything cause I'm not popping. We driving Ferrari cruising Bugatti you rocking Versace forever and never we going higher no go retire we getting paper this is my desire. Ukikosa sema asante. Weli weni Mungu na ukipata sema asante. Weli weni Mungu hata ukikosa sema asante. Weli weni Mungu na ukipata sema asante. Weli weni
T Piano on the mix.
Yeah, me all a day. A busy baby. Oh, lo, lo, lo. Merci beaucoup, bien.
Career Mothers for Exclusive Breastfeeding, CAMFEB Association 2020, WABA, World Breastfeeding Week, 1st to the 7th August 2020 statement. The 2020 World Alliance for Breastfeeding Action, World Breastfeeding Week,